Hi, I'm Dr. Andrew Junek from Peak Physiotherapy and Performance. I'm going to teach you how P3 solves neck and shoulder blade pain with physical therapy in Columbus, Ohio. First I want to start out with some of the causes of neck pain, headaches, and shoulder blade pain. So initially, you might actually start to feel some neck pain or some of these headaches due to a muscle strain. So when you strain a muscle, what actually happens is that muscle becomes overloaded. It's doing too much work, so it becomes painful, it becomes tight, and then it starts to give you some different symptoms related to neck pain or headaches. Not usually shoulder blade pain though. However, you can strain some of the muscles in the shoulder blade. It's just a little bit less common. Emotional stress. Okay, so high levels of stress can actually lead to an increased incidence of neck pain and headaches. We have research that shows this. Being more stressed out increases the tension in some of the muscles, and that tension can lead to overload or a muscle strain. You can also get muscle spasms where you'll feel like kind of the muscle twitching or jumping, or it'll cramp up and lock on you. That's another thing that can cause some neck pain. Joint issues. This one's super common. A lot of times you'll get a stiff joint. You'll sleep a funny way and that joint will be in an awkward position for over the course of the night. And because of that awkward or funny position that you've been in, the joint itself gets stiff and does not move the way that it's supposed to. So joint issues can also be a common cause of neck pain, headaches, and shoulder blade pain. You can also have nerve compression. So the way that nerves get compressed is there's a couple different ways. One common way is through a disc herniation. So a disc can actually move a little bit closer to the nerve root, and it can irritate the nerve root and start to cause symptoms related to numbness, tingling, sharp, stabbing pain, throbbing, aching. So it can be all of these different types of symptoms. The pain can radiate down your arm. It can radiate into the shoulder blade. So there's a number of different things that a number of different ways that nerve compression can also cause neck pain, headaches, and shoulder blade pain. Another way is through spinal stenosis. So what stenosis is as we age and get older, the canal or the hole that the nerve root comes out of becomes a little bit more crowded due to arthritis and other things like that, bony spurs. And because of it, that nerve root will get irritated and start to cause you some symptoms. Those symptoms can mimic that of a disc herniation, where you'll feel maybe some numbness, tingling, burning, symptoms down the arm, symptoms down into the shoulder blade, different things like that. Also, injuries. So car accidents, say you fall off a ladder, a blow to the head in a fight, things like that can also cause neck pain, headaches, and shoulder blade pain. Any sort of mechanical injury tends to be a little bit more difficult to treat. When things are due to trauma, your nervous system picks up the sensation of that or the threat response of that incident a little bit higher. So it's a little bit more trickier to treat. But certainly mechanical injury or external load or some sort of trauma to the area can be another source of neck pain, headaches, and shoulder blade pain. Certain types of disease, arthritis, meningitis, cancer. Obviously, these are the more rare types of things that can cause neck pain, the meningitis and cancer side, but it is possible. So it is important to have any sort of neck pain and headaches ruled out to make sure that nothing more serious is going on. And then lastly, another cause is bone pain. Sometimes the vertebrae itself can be a source of pain. Most of the time this is due in the case of like a fracture or a crack in the vertebrae. These are serious conditions and these need to be further evaluated. Sometimes people need to be placed in like a neck collar to keep their head from moving. Usually we see these after motor vehicle accidents or some sort of traumatic type of injury. We don't usually see a high incidence of like stress fractures in the cervical spine. So next, we want to talk about a little bit more on how we assess these things in the clinic. So when a patient comes in with neck pain, headaches, shoulder blade pain, the first thing we do is we look at your neck range of motion. We see if there's any limitations. If the neck can flex, extend, side bend, rotate, and if you can tuck your chin and look up, these sorts of movements will help give an idea to where the restriction is, if it's joint related, if it's muscle related, if it's nerve related. So it gives us some baseline information to compare it to later on. From there, we look into your reflexes, your sensation, your strength testing, because we're looking to see if there's any true nerve compression. If there is, then we may need to get a referral to someone else, or we may at least get some baselines that we can start to treat from, and then we should see some of those nerve signs go away as we move through treatment. So it just gives us more information, more data to be able to move forward and create a better picture of what recovery looks like for that patient. Then go through and do some different tests. And these tests are kind of specific to test out the nerves or specific areas of the neck and identify different conditions. So, for example, the top 3 joints in the upper neck tend to lead to headaches. So if you're having headaches, that's an area that I'll assess and do specific tests that are geared to bring out those headaches. Same thing goes with some of the lower cervical issues. You can have shoulder blade pain that is referred from the lower neck. And so that's kind of what I'm trying to tease out with that. So lots of different assessments, lots of different things that we need to look at to make sure that we can identify the problem accurately, and then from there, provide the correct treatment to get you better and back to doing what you love. And then the last part is we talk a little bit more about treatment. So for people who do have neck pain, some of the treatments that we do here in our clinics in Columbus at P3 are dry needling. So what that is we take a small monofilament needle and we place that needle into some of the muscles that are tender or may have knots in them, causing some of the pain. So we will do this, we'll leave the needles in for, a few minutes at a time, sometimes even up to, as long as 10 minutes, but usually no longer than that. And we hit some of those key muscle groups. We might hit the upper trap, we might hit the paraspinals in the neck, kind of along both sides. We might hit some of the rotator cuff muscles. So just a number of different areas, but it depends patient to patient what is actually driving the pain. Next, we'll do some corrective exercise. Every patient goes home with 2 to 3 exercises that are related to helping their neck heal and get stronger at the same time. So we target 2 different areas. So we'll target the neck muscles themselves, and we'll also target the upper back. A lot of times the upper back plays a role in posture. Poor posture over a long period of time, along with pain, can lead to sensitivity, and that sensitivity will increase until we correct some of the posture that is keeping this thing lingering. Okay. We also do cupping therapy. Don't use this as much for the neck or neck type injuries, but it is something that is available if the patient is the right patient for the treatment. What cupping therapy is, we use a vacuum sized cup, or the cup creates a vacuum around the skin, pulls up on it, and then I will actually move the cups around so that people don't have these large bruises on them. By not having the bruising, it doesn't change the effectiveness of the treatment. It just helps aesthetically for the patient, and a lot of people don't want to walk around with uncomfortable bruises on themselves. So there's a really easy way to mitigate that. I'll actually move the cups around, and it'll be more of a massage type of feeling, but it's very, very deep. So that's one option from a cupping side of things. And then last but not least, I will do some joint manipulation, again, if the candidate is right. And what joint manipulation is where you go in and say you have a stiff joint that's not moving very well, you will place it in a position to where you provide a very small but quick force, and you might feel a little pop in that area. That pop is usually associated with some short-term pain relief and feels pretty good for the patient. I don't do these joint manipulations on people who I have not thoroughly screened out to make sure that it's 100% safe. And most people don't even need a joint manipulation to have their neck treated and become pain-free. But there are some cases where if a joint is really stiff and a patient fits the criteria that I know a joint manipulation will help, we may go that route. So, but last but not least, I do have some tips that I wanted to share with you guys to help decrease neck pain and shoulder blade pain. There's a free guide that I created called the 7 Ways to Ease Neck and Shoulder Pain. This guide goes through several different tips that you can do at home. You don't need any special equipment, and it can help you get rid of or find some relief from your neck and shoulder blade pain. A lot of times patients come to me with shoulder blade pain and they've seen multiple providers. This is usually something coming from the neck. So this guide will help with that. So if you could do me a huge favor, click the link below to check out our website or schedule a free phone consultation with me, Dr. Junak. The reason I do these phone consultations is to make sure 100% that it's a problem that I can solve. If I can't solve your problem, I'm going to find someone who will, or who will be able to. Some people do require surgery. Some people do require imaging before they see me, and that's kind of the purpose of this phone consultation, to figure out where you are, where you've been, and where I need to help get you to. So thank you so much for listening. If you have any questions, feel free to comment below. Thank you.